Welcome to PACE YouTube channel. In patients with myocardial infarction and anemia, should we transfuse blood to push hemoglobin levels above 10 gram per deciliter? A major international study says, maybe not. Anemia in the setting of MI is common, and it's often assumed that increasing hemoglobin with liberal red blood cell (RBC) transfusion improves outcomes and quality of life. But the recent MINT trial, published in JAMA, challenges this belief. The MINT trial enrolled over 3,500 patients with MI and hemoglobin below 10. They were randomized into two groups: liberal transfusion group, transfused if HB 10; restrictive transfusion group, transfused only if HB 7 to 8. The primary focus here was on quality of life outcomes assessed 30 days after discharge. At 30 days, there was no significant difference between the two groups in EQ-5D-5L utility scores, visual analog scale for perceived health daily functioning in terms of mobility, self-care, and usual activities. In other words, giving more blood and raising hemoglobin didn't make patients feel or function better in their daily lives. In patients with a prior history of heart failure, there was a small subjective improvement in perceived health with liberal transfusion. But this was not seen consistently across other patient groups, and it remains an exploratory finding. This trial supports a restrictive transfusion strategy in most MI patients with anemia. More transfusion doesn't necessarily translate to better recovery or well-being unless specific clinical indications exist. The MINT trial is a strong reminder: when managing MI with anemia, don't just chase hemoglobin numbers. Focus on symptoms, clinical context, and evidence. Thank you for watching. This is PACE, where clinical practice meets evidence-based clarity. Like, share, and subscribe for more such insights.